they are a light emitting energy?
Exactly.
Okay. Energy by light, and they pound, I suppose they pound or they get absorbed?
Well, they don't
but
really
you don't
pound.
feel anything, do you?
You might feel like a little quick zing, but it's really quick. In fact, that laser you don't even need topical anesthesia for. You don't even need anesthetic cream on your face. It's such a minor thing.
Okay. It sounds like a miracle product or miracle tool that you have.
Well, you know, we're all used to seeing technology and computers and televisions and all the great things they do, and recently 3D movies. But there's other technology also that's really advanced, and lasers are advanced, and they're very specific as to what they do and how they're designed.
Okay, so let's repeat what the laser can do for you. We found out that we can work on the spider veins, whether it's on your nose, and that's probably one of the most common areas where it can be, correct?
Correct.
And you said brown spots. How does it remove a brown spot?
Okay, well, if I can digress for a second, and
Sure.
I'll just hold on to the brown spots, but it can treat rosacea, redness, all those conditions that people don't like, you know, redness of the nose, a lot of redness people don't like. Also, it can treat what they call port wine stains, the bigger pink spots.
Are those like birthmarks?
They indeed, most people are born with them, correct, and they can be quite embarrassing to people. This person actually had was a school teacher, and she was quite embarrassed by the red mark on her neck because she'd be trying to teach the children, and they couldn't pay attention because they were all trying to figure out what was going on with her neck. And so she was treated with a different vascular laser than the one for the nose, because they were all specifically designed. But she started with that big pink spot, and after a few laser treatments, her neck was basically gone.
Oh, wow. So it cleared it up, and it looks, the blemish is gone.
Yes, it makes a big difference.
Okay.
Makes a big difference.
Made her much happier, that's for sure.
Oh, yes, she was thrilled.
And is that permanent?
Yes, it is. That's a permanent change, because those vascular malformations that you're born with don't tend to come back.
Okay.
Now, the spider veins that people make on their face, if you're making veins, you're probably going to make more veins, because laser doesn't stop you from making veins. It only treats what's there, but it can't treat the future.
So in other words, if you've had your nose cleared up and everything like that, it could come back again. It doesn't mean that you haven't done your job. It means that the aging process continues and that you would have to come back for another treatment.
Correct. For the spider veins on the face, what happens is, and every person's different, could be 6 months, could be 5 or 10 years, but people who are making blood vessels go on making blood vessels because we haven't changed their body. So we haven't changed that they're making spider veins. We just treated the veins they made then.
Okay. You talked about making the skin tighter, brighter. How does a laser do that?
There are all different lasers that do that, and some of them are more aggressive and some of them are less aggressive. And I think the biggest revolution we've had since about 2006 is in what we call fractionated lasers. And it puts out little tiny beams of laser energy. And by doing that, it has a much quicker recovery than the old resurfacing lasers that most people who are watching us tonight are familiar with. And so it has a quick recovery, yet it gives you an improvement. It makes the skin tone more even, decreases brown spots, makes the skin smoother, decreases fine lines and wrinkles, tightens skin a little bit. We also have devices but that procedure still has about a 3 to 5 day recovery, and I'll show you photos in a second. But we also have a device for someone who doesn't want to deal with any recovery that just tightens skin a little bit, but doesn't have any recovery, and that's a different laser light device.
Okay. Why don't you show me that photo now, because I want to get on to fillers next.
Sure. Here is somebody before we treated them. You can see that. And then afterwards, if you look, and this is only about a week later, her skin is smoother, her skin's a little bit tighter, the brown spots are a little bit less. It's a softer look and a younger look. And so for a lady who's in her late 40s, her skin looks great.
That's wonderful.
It makes a big difference, and that's that new technology. Many people want to say, okay, well, if you're going to treat me with this, well, what do I look like in 2 or 3 days? Well, not everybody looks this good. But here's a different woman 2 days after we treated her. And you can see 2 days after we treated her, there are little tiny spots that may be hard for the camera to see. And she has a little pink, but she's having a pretty good recovery there.
Okay, wow, that's totally amazing what you can do with the lasers, and I'm sure everybody is very, very happy about that. We talked about fillers. Let's talk about what fillers are. What is a filler, and what are the methods that you use, and why do you use fillers?
Okay, there are different groups of fillers. So there are fillers where some people, you can use their own fat as a filler, and we call it facial liposculpture or fat transfer or fat grafts. But many people just prefer to have an injectable filler, which again, we just put a topical numbing medicine on their face. And right in the office, we can inject some filler with an artistic sense, get it so it looks very natural, and it looks like a younger face. So the fillers, most common ones we use are the hyaluronic acid gels, and those are ones like Restylane, Perlane, Juvederm. Those are the most common ones you hear about, and they've all been around for quite a while, and hundreds of thousands of people have been treated with them.
Okay, and what areas of the body would you put filler in? Or the face, excuse me.
Okay, you can put filler in different areas, and actually you can even put fillers in earlobes.
Oh.
Not a main thrust, but you have ladies whose earrings won't sit up pretty. They sort of come down because they've lost earlobe volume. Put a little filler in there, and their earrings will sit up nice and pretty.
Okay.
But here's a young woman who came in who has loss of volume in her mid-face. And there's loss of volume all in there, and deep lines, folds, and loss of volume around here. And just right in the office, the same day, you just add volume so it looks cosmetically pleasing and she has an aesthetic appearance. And you can restore volume, same lady, same day, and here she is once we're done. And you can see she doesn't even have makeup on. You can see that's much fuller, smoother, her lines are flatter, everything looks better.
So what I see here is that around the eyes, around the mouth, what about the forehead?
The forehead we get to with things like Botox. Can I just show a lip filler photo for a second?
Absolutely. Let's talk about that.
Many people also come in and they're not happy with their lips. And you see, I mean, ladies of all ages have this. And so here someone is before and after, and you see it's a very natural look. She doesn't look like any of the actresses we've seen.
Right.
But indeed, she does look better and fuller. Here's a lady who has an uneven lip. You see how uneven her upper lip is?
Oh, yes.
That's
it
for that
curves
notching.
up. Yes.
And then after we put filler in, we can not only make her lips look fuller, but we can also correct for that
She's got
notching.
lipstick on it. You didn't
Yes,
change
she
the
does.
color. Okay.
No, that's
one
lipstick.
Is,
yes.
okay, one is lipstick, but it's showing that
It's
everything
showing
is
it's all
even.
full in, and
Okay.
again, filling in it looks much better.
Okay.
Okay.
So you use fillers for the lips as well.
Correct, and you can have them look natural. You don't have to look like an actress. You can if you want to, but if not, you just get a very natural look, but you get a nice demarcation of where your lip stops and starts, where you'd normally put lip liner and such.
Okay. Give me, everybody's heard about Botox. What is Botox?
Okay, there's now two neurotoxins, and they're called Botox and Dysport. And what they do is they weaken where the nerve hits the muscle so that you get less muscle contraction. Certain lines on the face tend to be induced by muscle action. So the 11 we see here, the lines on the sides of the eyes, the bunny lines that a lot of people hate, forehead lines. And the goal of doing Botox or Dysport is not to make it so it doesn't move, but it's to make it so it's less. So it has a very natural appearance. You just look smoother. Things move on your face when you talk, so you look animated, because we all like to see somebody whose face moves, who smiles and such, and looks animated, but it just looks like a smoother, younger look. It also opens up the eyes. It's amazing how much you can open up the eyes with some Botox. You can lift the lids a little bit, just get everything looking a little bit brighter and better.
Okay, fine. So Botox is something that has to be repeated, though. It doesn't last forever.
Botox and fillers do not last forever. Depending on which you use, they do change. And there's also a new neurotoxin called Dysport.
Okay, so that's a repeated process, and that people have to come back every, 3, 6 months? How often?
It varies from person to person. Most people get 4 to 6 months. Some people get less, some people get more. Often fillers in the lips, you can get close to 8 months. But Botox, after about 6 months, it's worn off. And you get a better long-term